Hi,
Hi.
good morning.
Good morning.
How are you?
Good, thanks. How are you?
I'm Amy. I'm the hemodialysis nurse. I'm
Okay.
going to be with you throughout the procedure today.
Mm-hmm.
May you know your name, please?
Sure. Sarah Austin,
Sarah Austin, may I know your date of birth, please?
25th October 1991.
Would you mind if I
Oh, no,
sit
no, no.
down?
Yeah, for sure.
So that I will be on the same level as you are.
Yeah.
So while we are talking, I'm going to be taking little notes.
Okay.
So I can inform our doctor and nephrologist if we have any concerns.
Okay.
And because we need for the communication for either the nurses, so I'm going to be taking my notes. Okay. So you said you're Sarah Austin, date of birth.
Yes.
Okay. So also, how are you feeling today?
I'm feeling pretty good.
So is this the first treatment for you?
No, it's been a month.
It's been a month.
Yes.
So how that fistula going along with you?
Yeah, it's going pretty good. Like in the beginning, it was hurting a bit,
Okay.
but now it's pretty good. Like now it just hurt when they put the needle in, but
Yeah.
except than that, it's pretty good.
But in the beginning, I know it's the new stuff for your
Yeah,
body. Of
yeah.
course, it's hard.
Yeah.
So other than that, it's fine.
Yeah.
Any pain, any oozing, anything?
No.
No? Okay. So before we proceed, I'm just gonna take your consent because I'm gonna be touching your arm, one for the blood pressure, one for fistula check.
Mm-hmm.
I'm gonna be checking your legs as well
Mm-hmm.
because of the fluid.
Mm-hmm.
So is that okay?
Yeah.
Is that okay? Okay.
Yes.
I'm gonna be checking your vitals now.
Okay.
I'm gonna check your blood pressure first. Sorry. I don't wanna forget this.
Mm-hmm.
I don't wanna give you any infection.
Mm-hmm.
Okay. Alright. If you are uncomfortable, please let me know.
For sure.
Okay. Okay, you relax your arm for me,
Okay.
please. Relax your arm. Thank you. Okay. I'm gonna be checking your pulse. Okay. So when I'm seeing your blood pressure,
Mm-hmm.
little high.
Okay.
187 by 98.
Okay.
Pulse is 105.
Oh.
I was checking your aspiration. It is sitting between 22 to 26.
Okay.
And I'm gonna check your temperature as well, just to make sure you don't have any infection. Okay. It is 36.8.
Okay.
Are you on any anti-hypertensive medication?
Yes, I am.
Okay. So
Actually, I'm on a couple,
okay.
but one of my blood pressure medication got decreased the day before yesterday,
Okay.
but I totally forget the name.
So before you proceed, can I check your legs, please?
Sure.
Okay. I just wanna leave my hand.
Mm-hmm.
Okay. Is it hurting?
Yes, a little.
Oh, I'm sorry.
No, it's okay.
But if I'm seeing your legs, can I see the other leg, please? It's a little edema. Do
Okay.
you have any shortness of breath?
Sometime, yeah, when I walk,
Okay.
it like I feel hunger for air.
Okay.
Yeah, but then I catch the breath.
Okay, you
Yeah,
do.
yeah.
Okay. So I'm gonna check in your lung sounds as well
Okay.
because you said you are shortness of breath.
Mm-hmm.
I'm gonna take you. Good. So while I'm checking your lung sounds,
Okay.
there are the crackles.
Mm-hmm.
You know, crackles when water is boiling,
Mm-hmm.
bubbles,
Mhm.
just like that.
Okay.
That means there is extra fluid on your legs,
Mm-hmm.
a little swollen because of the fluid. Of course, that's why we are here for. We're gonna take that whole fluid out of your body.
Mm-hmm.
So while I checked everything, would you mind standing up on that weighing scale for me, please? Okay. Chin up. Okay, it's 84.
Okay.
Is that normal to you?
No, it's not.
Okay. I'm gonna be writing the weight here.
Okay.
But we're gonna bring down, like, I'm gonna be calculating everything. My goal is between 80 to 81 kg. But of course, as you said, your blood pressure medication is decreased and you're drinking water. You said you brought 2 glasses of water here, right? So I'm gonna be discussing with your nephrologist, but
Okay.
before that, I'm gonna collect all the data
Mm-hmm.
because then he can ask me some questions regarding that. Okay? Any bleeding risk? Any?
No.
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 Any blood in urine, stool?
No.
No. You're fine otherwise. Okay. Okay. And how about the diabetic stuff?
So I am
Because
diabetic.
I'm
Yeah.
sorry to interrupt.
No,
you.
no, no.
Because I read your diagnosis. It says the diabetic.
Yeah.
Yeah.
So
Diabetic.
I am diabetic. So I'm checking my blood sugars at home. So everything is in here for you.
Okay.
So I check my blood sugar at home and I record it for you. Keep a record for you guys.
Thank you. Thank you.
And I'm not taking anything for that. So
No?
yeah, I'm
That's
controlling it. Yeah.
That's great. Okay.
Mhm.
I'm gonna be keeping this with me just to write on my notes.
Okay.
Also, I'm gonna be checking your fistula. But before that, if you have any question in between, you feel uncomfortable, please let me know. Okay.
Sure.
Just interrupt me anytime you feel uncomfortable.
Okay.
Okay.
Yeah.
I'm gonna be checking your fistula. I'm gonna be I'm gonna be looking at your fistula, listening to it, and feeling it.
Okay.
So I'm gonna be looking at it.
Okay.
If I'm looking at it,
Mhm.
your fistula looks very clean to me.
Mm-hmm.
There is no blood or oozing in it,
Okay.
so which is fine. If this arm is warmer
Mhm.
than this one,
Mm-hmm.
you let us know, please.
Okay.
So if there is any oozing, any swelling, this arm is bigger than
Mhm.
this one,
Okay.
please let us know.
Sure.
You see any kind of smell coming out,
Mhm.
you feel this arm is smelly, let us know, please, because that's sign of infection. I'm gonna be checking the temperature of this arm than this one.
Mhm.
Okay. So when I'm checking the temperature, both arm temperatures seem same to me. I'm gonna be listening, and I'm gonna be listening to your fistula, which is called brute. Brute is like a swooshing sound.
Okay.
If it's normal, we are good.
Okay.
Okay, I can check with the fingers,
Okay.
but I just want to make sure with the stethoscope. Okay. Yeah, it looks good to me.
Okay.
Also, if you feel like there is any extra pulse, like
Mhm.
you really feel it's like this,
Mm-hmm.
any feeling like that,
Mhm.
just keep eye on.
Okay.
Also, I'm gonna be feeling a
Mhm.
thrill, which is
Mhm.
like a bee buzzing.
Okay.
Okay, it's like a vibration sound.
Okay.
You can feel it like that,
Mm-hmm.
but again, I want to make sure.
Okay. Okay.
Yeah, I can feel the thrill.
Okay.
So which is normal. So if I'm gonna be checking the pulse, I'm gonna just check with the fingers. Yeah, pulse is pretty normal.
Okay.
If you see like it's really pulsatile, it's
Mhm.
really fast,
Mhm.
that's abnormal.
Okay.
So if like I'm checking these things, if you find like it's really fast, you
Mhm.
can feel in your arm, please let us know.
Mm-hmm.
I'm gonna be checking your arm. I'm
Mhm.
gonna be raising it above the heart level.
Okay.
You see now,
Yeah.
this is getting flat.
Mm-hmm.
I'm checking it, it's soft and
Mhm.
flat.
Mhm.
That's normal.
Mm-hmm.
If you see like a fistula is like a wire, it's
Mhm.
coming up,
Mm-hmm.
that's abnormal.
Mm-hmm.
It's protruding out of your arm,
Mhm.
that's abnormal. So
Okay.
when you want to check at home,
Mhm.
just check like that.
Mm-hmm.
If you can, or take any help.
Mm-hmm.
You have any help at home?
No.
No, we're gonna be discussing it. Don't worry, that's why I'm here for.
Okay.
But I collected everything. I'm gonna be writing my notes here.
Mm-hmm.
So I'm sorry, I forgot the capillary refill. Capillary refill is just like when your blood return quick
Mhm.
in your fingers. So
Mhm.
I'm seeing it's normal.
Okay.
You see, it is coming back right away.
Mhm.
That's normal. If it takes longer, half a minute or so, that's abnormal.
Okay.
I'm gonna be discussing with your plan today what we are doing. Your daily weight today was 84, and my goal is 80 to 81 kg. But of course, there are some changes in your vitals and stuff and your medication. Of course, I have to discuss with the nephrologist. And your
Okay.
dialyzer Revamax is 400,
Mm-hmm.
and your dialysate bath is 1.25,
Mm-hmm.
3K, and sodium is 140. Dialysate flow is by 500, temperature 36, which is direct connection, and your heparin is 2500 by 1000.
Mm-hmm.
I'm gonna be stopping after 2 hours from the beginning time,
Mm-hmm.
because I just don't want to put you any at bleeding risk. Okay, because your total time is three hours, but I'm
Mhm.
gonna be stopping after 2 hours.
Okay.
Also, your URR, which is urea reduction ratio, like whatever you put in your body, the kidneys bring it out from your body as urea, so which is a toxin. Take out of your body, and whatever ratio, because you're coming here 3 times per week, should be 65%.
Okay.
But here in the chart it's showing me 55 to 60%, which is teeny bit low.
Okay.
But of course I have to discuss with your nephrologist, right? And your blood flow rate will be maximum as tolerated. And then I'm going to be calling the nephrologist now, so I'll be back quick.
Sure.
Any questions so far?
No, not that.
I'm not too fast, right?
No, not
Okay,
at all.
let me know if you have any question in
Sure,
between, okay?
sure.
I'll be back. I'm going to be calling your nephrologist,
Sure.
okay? Hello, Dr. A. This is Abby, hemodialysis nurse. This is regarding Sarah Austin. She's here for her hemodialysis treatment today, and her vitals are pretty variable. Like her blood pressure is 187 by 98, which is hypertensive, and pulse is 105, and her URR is between 55 to 60%, and she's coming here 3 times per week, which is a little concerning, and her antihypertensive medication is decreased, but she's not aware of. She forgot which one is that. So would you mind calling me back in here so we will be on the same page and I can start her procedure. This is AVRN from the hemodialysis unit. Please call me back. Thank you. Bye. Sorry, he didn't pick up my phone.
Oh, okay.
So I'm going to be discussing some treatment plan with you while he's calling us back in the unit.
Okay.
Is that okay with you?
Oh, yes.
Of course, you want to have a little guidance, right?
Yes.
So first of all, you said you're thirsty. So for that, I'll just take little ice cubes when you're thirsty. Or you can have candies, sugarless candies, stuff like that. Anything else you can suggest of, you think? Do you like ice cubes?
Yes, I do.
Yeah, that's good then. Then that will help, because you follow your nephrologist's instructions, because you're on fluid restriction, and we don't want to put that extra fluid in your body, which will be really hard for you because you're already short of breath, right?
Yeah.
Also, you said what you eating since last few days, because your blood pressure is a little high.
So I had KFC fried chicken
Fried chicken.
last night.
Okay, so I would suggest try to avoid that.
Okay.
And try to have a little less sodium diet, potassium, phosphorus. I'm gonna be you have internet access at home,
Yes.
so you googling.
Yes, I am, but I'm cheating on it. for
Okay, so I would suggest have less salt in your foods.
Sure. Okay.
Avoid canned food.
Okay.
You can have it, but try to have less amount.
Okay.
And then quinoa, like stuff like that have lots of protein in it. Try to avoid it.
Okay.
Okay. Any other questions for the food?
No, if you can give me a pamphlet.
I will.
Yeah,
I will.
that'll
Of course.
help.
Of course. That'll help you. And then,
Yes.
and other thing is try to have less sugary stuff as do you're diabetic, right? And then if you have any increased intake of the fluid and increased urine output, please let us know.
Sure.
Because that's concerning. Okay. And also, you said you don't have any help at home. You want any
No.
help?
That'd be nice.
That will be nice. I'm gonna talking to my social worker.
Okay.
For that, we're gonna be sitting together. We're gonna be discussing the finances and stuff. Of course, that's her job. You can discuss everything with her, but of course, I'm the one who's gonna be arranging this meeting. So you can discuss anything you want. Okay.
Okay.
So that way you'll have some help.
Okay.
Also, there is other support groups like people who are having hemodialysis. All the people sit in that, so you can have your experience shared with them, and they can share their experience. Because when you're sitting at home, you think you're the only one suffering from this. So when you share your experience, you're gonna feel a little better. So any other questions?
No, I
I'm
don't.
gonna be writing here my notes that I have to arrange your meeting. Okay. Medication, please keep track of that.
Sure.
Because you wasn't aware, so it's for your safety, of course, and then it help us that you're keeping track on. And of course, you're charting very well for your vitals and weight stuff, which is great. Any
you.
questions?
No, I think I'm pretty good. You explained pretty good.
Oh,
that
thank you.
That's nice.
Thanks, that's my pleasure. I'll be back.
Sure.
I'm going to be talking to your nephrologist, then we will start the procedure.
Thank you.
Thanks.
Yeah.
I'll be back.
Sure.
Okay, bye.
Bye.